Kia ora, Nehemona Skara here. My absolute pleasure to be having this awesome kōrero, this wānanga with two incredible young men, two brothers from the far north.
Kia ora, I'm Jack Manga. I'm 22 years old. I'm currently a mental health registered nurse.
Kia ora whānau. My name's Dean Manga. I am 24 years old and I'm doing a Bachelor of Nursing degree, the Māori program. We take all the fundamentals of the general nursing program, but looking at it through a Māori lens, and it's things like karakia, understanding like the tikanga and the ways we do things. And it's awesome, it's empowering because it's like focusing on things, like whānau, focusing on the individual and everything else about them.
Is there anything that people might not know in terms of the mahi?
You've got everything in there. You've got building relationships with people, you've got the counseling aspect, you've got friendships, man. You get some lifelong friendships. Feel like you're actually making a difference.
What's some of the most rewarding parts to this type of mahi in terms of what you get?
Being that catalyst of change to improve people's lives and to be a part of their journey from start to finish. Oh, wow. It's one of those things that like fulfills that desire which money can't buy. Working in mental health is a incredibly meaningful career because you work with people during the highs and lows. The people that we deal with like look to us for guidance and stuff. That kind of like strengthens your own character and like your own resolve.
I like talking to people. I like knowing about, what makes them them. We're all the sum of all of our experiences.
What's it like, working with some of the other kaimahi, working, in a team?
It's that camaraderie. It's awesome working a part of a team. And it is, because at the end of the shift, when you knock off, even when it's stressful, you just, you can debrief, talk about everything that's gone on, what you can do better next time, and support each other because you've all gone through it together.
Why do you think it's important the mental health and addiction workforce includes nurses from the communities that they're helping?
If you guys can share familiar things like belonging to the same culture, that tikanga, and having an understanding of, sharing that common upbringing, like that's one of the biggest things I found in mental health is it's rapport. And that comes from having a workforce which represents the community which they serve.
I mean, we all know mental health doesn't discriminate. Doesn't care who you are, where you come from, and it affects everyone, not just the person who's dealing with it. And so this is why it's important to have, diverse cultures and people from all different backgrounds and all ages.
What would you say to the people out there, especially our young male Māori rangatahi that would be thinking about getting into this line of mahi? What would you say to try and, encourage them?
Jump into it, It's challenging. And it will push you and it will test you, but that's how you grow. Don't worry about what society thinks.
Being male and Māori and going into nursing, just look at the statistics. It's a female-dominated profession. It's kind of like a character development in a way because you learn how to care for other people and deal with their issues. And I think it's a meaningful career.
We need to have more of us and just, need to get out there and do it, man. Do it for the boys. Do it for the boys, because there's people out there suffering, and so
keep leading the way, brothers. The mahis are doing, it's incredible, and it's going to help a lot of people out there. How much impact you're having on our young brothers and sisters, and that is going to be, you can't sort of put a measure on it, or it's bloody massive. So thank you so much, brothers. It's been awesome to kōrero, and thank you both